Right, here we are, live for the Osteo Allies members community. So thank you very much for inviting us to do your Instagram takeover. My name is Daniel Lawrence from RockTape, and that's what we'll be talking about today. We'll be talking about rock taping, a type of taping, or a type of kinesiology taping. So first off, what is this tape? Well, hopefully many of you have seen it or have used it, but I should imagine that a few of you tuning in would not have used this tape before, or perhaps would be considering it, or perhaps even not considering its use. Well, it's been around for quite a while. It was actually invented by a Japanese chiropractor in the 1970s and has been widely used in the Western Hemisphere for about 20 years at least, and particularly off the back of the Beijing Olympics and subsequent Olympics since then. So what it is it is a type of tape designed for human use, although it's also now used commonly on horses and smaller animals, but we won't go into that on this talk. It is elastic, nice and stretchy, which is good when you use it on the human body because the body likes to move, so this is not going to stop movement, it's going to encourage movement. It's breathable as well, and the glue has a wavy-like pattern which leaves gaps, and through those gaps it allows the skin to breathe, and that's one of the components that makes it hypoallergenic, i.e. very low risk of allergy or irritation, meaning you can sometimes wear the tape for a number of days and the breathability maintains the health and integrity of the skin and also deals with sweat and so on. So it's not just a short-term use, it can be a mid-term use, and in particular taping in between your treatment sessions is often something which is considered a good idea and one of the values of using tape. So yeah, Kinesiology Tape, there's various brands available. RockTape is known as being one of the best brands out there because of the way we work with professional groups such as Osteo Allies and the physiotherapy groups and chiropractic groups and sports therapy groups and massage groups and so on. So hopefully if you're not involved with us, then you would consider, after watching this, getting involved with us and finding out a bit more. In terms of finding out some more, you can have a look at our RockTape UK YouTube channel. That's a brilliant place to find some more free content, and of course check out our website where you'll find lots of other helpful information. So why might you consider using the Kinesiology Tape, which comes in various colours, by the way, which is simply a matter of colour choice. It doesn't denote anything to do with the qualities or the tension of the tape. Now, one of the reasons why you might want to use it is that it can be very helpful and effective for reducing aches and pains from a number of different pathologies from various joints and muscles around the body. And there's a good collection of ever-increasing research showing that taping can be helpful for reducing pain from common ailments like knee pain, whether it's patellofemoral pain or osteoarthritis. There's evidence looking at taping being used to help with the management of both, not to mention many other conditions such as plantar fasciopathy, shoulder pain, back pain and so on. What we're going to do in this session, guys, I'm going to show you some lower back taping, so lumbar spine taping, and hopefully this time I'm going to show you a quick posture application for the upper back, so looking at making adjustments or making the patient more aware of their thoracic posture. I'll show you a quick taping technique for that. So I mentioned about pain relief, and of course I've just mentioned posture as well. So taping can be very, very useful for giving people an improved awareness of what their body is doing, what position it's in and how it's moving, and therefore is brilliant for looking at making some changes to posture or dynamic posture, right? The way people move. So let's have a look at how we can apply the tape to the lumbar spine. Okay, cue patient. Could you stand here side on to the camera first? Perfect. Okay, here we have a patient who actually does have some back pain today. So what I'm going to do is measure their forward bend, and this is what I'd recommend you do as well. So all we need to do is to get the patient to bend forwards, bending their back, flexing their lumbar spine as much as they can, and you can measure how far down they can go, like touching their leg or touching the floor, or you could do a test and measure their lumbar flexion. There's a Schrober's test that you can do, which allows you to take a measurement of lumbar flexion before you come back up again. So measuring it before and forward bend again. And after, the Schrober's test is very useful for looking at that lumbar flexion. And then if you were to repeat that after your taping, hopefully you would see some improvement and you would achieve some pain relief for the patient. Hopefully both of those, if not at least one of those. And from experience in practice, this works really well the vast majority of the time, and it's quick and easy to do. So let's have a look at how we do it. If you can go and take your seat round there, please. Okay, so you want the patient seated. Well, it doesn't have to be seated, but it's the best position for this one because what you need is a maximum pain-free stretch in the area that you're going to tape. So we want to tape the lumbar spine. I'm going to get my patient to just lean forwards a bit, rest their elbows on their knees. So we've got a flexion through that lumbar spine. They've got their feet on a footrest underneath so they don't topple forwards. And here we've got pain-free stretch. Now, of course, as osteopaths and as a physio, I'd be recommending that you do your time-tested, well-known, trustworthy treatments in order to improve this position before you actually tape. So you may be massaging, mobilizing, manipulating, so that you can improve pain-free flexion before you put tape on, and then of course you're maximizing the output. Tape's designed to work with you and work alongside you and to mix in and mix and match and combine with the things that you already do. Even though you can use it in isolation, it's really designed to, to be your assistant rather than just an isolated way of treating. Okay, and with our RockTape education team, we have a few osteopath tutors, a couple of tutors teaching the human course, and also a tutor teaching the equine course as well. We have a chiropractor and some physios, a sports therapists. We have a real mix of professions, which helps us to create our education content, which resonates well with all different professionals. Right, enough talk, let me show you what I'm doing. I'm going to measure a piece of tape to cover the lumbar spine. And it's going to cover a little bit more than the lumbar spine. So it will go from just above the pelvis up to the lower thoracic region. I want two pieces, one on each side of the spine over the dome of the lumbar erectors there. So I'm going to cut those pieces equal length. And with taping, there's a few golden rules, things that you need to do to make the taping work for you. I'm doing one of them just here, around the ends of your tape. Okay, get a bit closer so you can see that. Cut the edges off the tape, and that will make the tape stay in place for longer so those edges don't catch on clothing. Okay, so patients in a pain-free stretch position, we'll just pull the tape so the tape stretches and the backing paper rips, and that allows us to unstick, peel the backing paper away without touching the glue side of the tape. So I'll go ahead and place that on the lumbar spine just here. Okay. Now, although the tape is stretchy, we want the stretch to be used by the body's movement, so we don't want, in this case, to add extra stretch. So I'm going to put the tape on the skin with minimal stretch. Okay. Sometimes you need to stretch it just a tiny bit to make sure the tape stays in shape and doesn't end up creasing or sort of recoiling too much. Once again, tear the backing paper, peel that away. You can see how quick and easy this is, and place that on the other side. Okay, once it's in place, rub the tape to make sure it's firmly stuck down on the skin. That warms it up a bit as well, and it may help to activate the glue and adhere it to the skin a little bit better. So those pieces are on there. Now then, either using some of the same size tape, or if you've got it to hand, and for practitioners working a lot with lower back pain, I would definitely recommend the wider tape, which is 10 centimeters wide. That goes across the lower back and provides a lovely feeling of support, not just pain relief, but a really nice feeling of support and comfort on the lower back. And if you have an achy back yourself as a practitioner, just putting this piece on, because it's hard to do these on your own, but if you've got a willing colleague, of course you can, but just putting this piece on yourself can be really, really comforting for lower back pain. So if it's a top tip for you, if you're in clinic and you think, oh, my back's a bit achy, I wish I was actually the patient right now instead of the osteopath, then you can get a piece of this or 2 pieces of the other thinner stuff and stick it on your back. All you need to do is bend forwards like we were just doing a second ago, and then stick the tape on your back. It's quite easy once you've given it a go and practiced at least once or twice. I'm sure you'll get it halfway right. Anyway, there we go. Peel the backing paper away. Identify the painful area for the patient. So where was that for yourself? Did you have a sore spot? Okay. This piece is stretched and stuck over the painful region. So depending on what level that is. Okay, so make sure you guys can see. Stretch and stick. Again, rub to stick, and that's a large piece of tape there, so make sure that sticks down nicely. Okay, and then if our patient sits up straight, we can see that the tape is loose and there's some like ripples or laxity in the tape. That's a good sign. It shows that there's a reduction in tension at the surface of the skin. Also shows the tape is not pulling, because if it was pulling, it would be more postural, and that would be forcing the patient into kind of an upright position, which typically is not that helpful for lower back pain. It's more about reducing tension rather than actually trying to encourage and increase it. Okay, so we'll have our patient come around and do their forward bend test again. Don't forget, this is a real patient I have for you today who actually turned up with some back pain, so let's have a look and see. Their forward bend wasn't bad at all, but it's definitely improved. And how does that feel?
It's good.
Yeah, feel a bit easier?
Yeah, the dull ache's gone.
Fantastic. Okay, so the dull ache has gone. Brilliant. How much should we charge him, by the way, guys? I need a consensus on how much we should charge for this rapid pain relief. Let me know in the comments. Right, I've got something else for you. I'm gonna just get you to stand for this one. So you could stand perfect where you are. Yeah, thank you. And are you okay to take this one off?
Yeah.
Okay, so we're going to have a look at taping for the upper back now. This is a bit different. What we've just done was symptom reduction taping, or pain reduction taping, i.e. putting tape on a sore lower back and making it move a bit easier and feel less painful. Quick and easy to do, highly recommended, and hopefully you can even have a go off the back of watching this video. Next, let's have a look at thoracic posture. So of course you have a patient and you want to work on their posture, and we'll think about thoracic alignment here in the sagittal plane. So it's natural to have a kyphosis in the thoracic spine, but you might be looking to try and reduce that kyphosis, and maybe you've just done some mobilizations or that lovely dog manipulation where you manipulate the thoracic spine, and they're feeling a bit more mobile and they've got some better extension, but they still have a habit of dropping into that flexion, and you want to give them some exercises and give them some cueing to try and get them to sit up straighter. Now, fortunately, this is elastic, so we're not going to be bracing our patient to be upright and have no option but to be upright for the remainder of their days. We want to give them a polite nudge and a little bit of cueing through the skin to let them know, in combination with exercises which you would have given to them, and in combination with understanding why they're doing it, why the tape's there and why the exercise is there. So the taping itself is very simple. We've got a few different ways of doing it, but I'm going to show you a nice easy central application. So it is going to go over the centre of the thoracic spine there, and it's going to stop just short of the neck. There's no need to tape up into the neck, and some areas of the body are less responsive and taping is less comfortable, and the neck is one of those. So got the tape here. Round off those ends. It's one of those golden rules to make sure that your taping works for you. Put the scissors somewhere safe. There we go. And do that again. Rip the backing paper. And off we go. So let's start that at the top so I can be precise about where I'm starting. Okay. There we go. So if you come back this way a little bit so we're close to the camera. Thank you. Okay, it's going to check. Yeah, that's it. Just checking it's in the centre because it's hard to see when I'm standing to the side. Okay, and then it's a case of stretching it a little bit and sticking it on the skin. But we also need to think about patient position. So let's have you nice and upright in a neutral position there. Good. So you put your patient in the desirable position. Try not to overcompensate. You don't want them like, whoa, standing like that. But also if you don't do enough, the tape perhaps won't give them enough of a stimulus. It's probably better to not do enough because then you can always just have another go and reset it and put a bit more tension in. Better to do that than to put too much tension in and have the patient too up, because that can be really uncomfortable for them if they're spending the day going around with the tape constantly pulling on their skin. So try to undercook it rather than overcook it. Let's have a look. So if I just hold that there temporarily, if you bend forwards for me, sorry, come back up again, just from here, just slump, let your head drop. Can you feel that?
Yes.
And back up again. Okay. Do you want that a bit tighter?
Just a little bit.
Okay. Great. So the patient felt it, as you heard, they wanted it a bit tighter. So try that. Slump forward.
Yes.
Yeah.
I feel that.
Back up. Okay. So there's no stretch here. I stretch this bit and I customize that to suit for the patient, and then rub to stick to make sure that's down. All right. So the patient can still slump from your, they can still slump if they need to, obviously tying up shoelaces and so on. But when they do that, they feel the pull of the tape and they think, what's that on my back? It's tape. Why is it there? It's to remind me to hold myself upright. Wherever I've been to see the osteopath, I must remember as well, I've got the exercises to do, in the mornings, the evenings, etc. And it all ties in together. So it's not just a bit of tape. It's like a rehab buddy that's reminding them and cueing them throughout the day, as well as giving them nudges to do some of the other important tasks that you may also remind them of their next appointment. Oh yes, that's on there. I've got an appointment next Wednesday. It might be helpful for that. Maybe even write your appointment time on the tape. So when somebody sees their back, they say, oh, you've got an osteopath appointment today. You better hurry up. Anyway, I hope you found that helpful. I'm just going to wrap the session up and then see if we have some questions come through. Would you like to have a seat just around there again?
Yep.
All right, so we introduced the RockTape, which is a type of kinesiology tape, perfect for human use because it's of elastic qualities and breathability. And I've shown you a couple of applications. The lower back one, primarily for pain, but often improves movement as well off the back of the pain reduction. And this is a lovely technique. Even this blue piece across here, if you just put that on in isolation, still can work wonders. And I'd recommend you try that yourself if your back is aching a bit in clinic. But the lumbar one is one of the core parts of our course. And I wanted to show you today because if I was going to show you one technique, this is definitely one which you can take away and have a try and get some good results from. It doesn't really matter what the underlying pathology is. What we're dealing with is pain and movement problems, and the tape is most likely to help with pain and improving movement problems from a variety of underlying causes. Appreciating, of course, that the causes underneath are many, and particularly if they're structural, there may be some structural limitations as such, but you're still likely, if there is potential, to release some of that potential from your patient using something like the taping in combination with the other things that we've been discussing, and of course the things that you likely already do. And you can see this shining on the screen quite nicely. The vertical piece here, not only was this on a different area of the body, but it was for a different thing. So rather than for pain, this was actually there to encourage the good posture, or to discourage a habitual excessive thoracic kyphosis, of course. Again, appreciating underlying structural issues and so on, but it can still be highly valuable. We saw here some laxity in the skin where the tape was causing some like ripples in the skin. So that's like a very mechanical, fascial view of things, and this ties in with our theory of decompression, the decompressive elements helping with slide and glide and fluid flow and so on. So that's one of the mechanistic theories for taping. This one perhaps relies more on the neurophysiological theories and mechanisms of taping, because when you go forwards, there's a pull on the skin and it increases your awareness, it boosts your proprioception for that region, and therefore it's much of a neurocentric driver to how this piece of tape is working. And they're the two mechanisms that we discuss on our courses, the effect on the nervous system and the effect on skin, fascia, decompressive fluid flow, and also that includes pressure on the nerve endings as well. So of course there's crossovers between those two systems, but they're the two things, decompression and neurostimulation, and I think they've been demonstrated here with these applications as well. So yeah, there we go. I hope you can, if you haven't already, give those a go in practice and they'll work well for you. They are quick and easy and simple, but when you combine them with probably what you're already doing, they can be very powerful and enhance your outcomes as well.